Hi everybody, I'm Laurie Cadden. We are in a medical room, what do you call these, Doc? What do you call these rooms? An exam.
Room.
There we go. Which is unusual because usually we're at TCMC. We're away from there for this year. We're on the road. We're taking the show on the road. We are with the Lackawanna County Medical Society's Public Health Education Series, Doctor. And we are here with Dr. Joel Laurie, who is an allergist with Horizon Medical Group. We are in one of the rooms that this wonderful guy, who I just met and I already love him, would be able to diagnose allergies. Let's face it, we live in northeastern Pennsylvania. Allergies are all over the place. Doctor came from Long Island. He's been here for 20-some, He's been here for 20-some years. What is it with allergies? What causes it? What is it?
Everybody's got allergies. You know everybody. Your friends, your family, I'm sure a lot of people have allergies. And one of the interesting things is the allergies have been increasing every year for years. If you look at 100 years ago, nobody had allergies. It was unheard of. It was a very strange thing. Nowadays, everybody got allergies.
Why?
Well, let me first tell you what allergies are,
Okay.
since you did ask me and I didn't answer
I did. I'm sorry.
So allergies are the mistake. Your body's immune system is mounting a response to something that it shouldn't be. It thinks that these pollens or the dust or so on is a foreign invader, and so it starts making a whole response. And your problem is all the body's immune response is causing what's called friendly fire. So if you think about it, if you have a foreign thing, a parasite in your eye, what do you want to do? You want to have your eyes water and wash it out and get it out of there. Well, that's the same thing that's happening with pollen. If you start getting a parasite into your nose, you want to sneeze, you want to get stuffy so it doesn't get into your body. But the problem is it's having this reaction to something that doesn't cause problems, that shouldn't cause problems normally. So it's an allergy. It's an abnormal, mistaken immune response to something that your body should ignore. There's a lot of theories as to why allergies have been increasing, but there's no question it's been increasing tremendously. One of the theories that I do like a lot, if you look at a third world country, I don't know if you're allowed to say that politically, but a third world country, you go to India, you go to Africa, no one's got allergies. The thinking is they're exposed to so many germs early in life that their body's immune system matures normally. So they find that kids who grow up on farms, kids who have a lot of other older siblings, have less allergies. And the thinking is that they've been exposed to enough germs that they don't stay in this immature allergic response.
Do you think it has something to do with how crazy we all are now with our hands and all of those soaps? And I'm a freak, I'll admit it. I've got OCD and I wipe after everything. And the antibacterial this and that, could that have any? Because that just sort of came out all of a sudden.
Well, that's the thinking, is that you have to be exposed to enough germs, especially in that critical first year of life. So you want the kids crawling on the floor. You want them, no 5-second rule, maybe 5-minute rule. And the kids grow up with pets, especially dogs in the house. They have a lot more germs, and therefore they tend to have less allergies.
Wow. So what if it's, if it's something that develops, I know there's some children who have peanut allergies or things that start when they're little. What about people who get them later in life? Issues, and like I said, since I've had both my children, I've got allergies. I've never had allergies before. Sinus issues, all this stuff. What happens with that as opposed to someone who's younger and develops it versus someone who's older?
Well, allergies can happen at any age. They tend to be less likely after age 50.
Okay.
But it can definitely happen at any age, and it depends on what you're exposed to. So for example, we were talking about Israel before. When people go from one country to another, for the first 5-6 years, a lot of times they don't have allergies because they're not exposed to it long enough. But after enough exposure, they start developing allergies to the new allergens that they're being exposed to. So if you go to a desert country, the problem is going to be olives and so forth. You don't have that here in northeastern Pennsylvania, but after several years of being exposed, they may develop allergies there.
So what is the best way then to treat an allergy? To know first, do you need, I'm a big fan, I say this all the time, I self-diagnose all the time. I know that isn't right. So is it best to come and get treated so you know exactly what these are instead of saying, oh, I think I'm allergic to this, I think, what's the best way to diagnose that?
It really depends on the person. You have some people who have just mild allergies and they sniffle once in a while. We don't care. They don't care. They live their life. They're perfectly fine. So allergies can go from very mild all the way to life-threatening. I mean, there are people who die of peanut allergies. There's people who die of allergies from bee stings, from medicine allergies. So there's a very wide range of how severe the reactions can be. So it depends on the person if it's worth getting treatment. In general, when I treat allergies, I usually say there's 3 steps to treating allergies. Now, when I'm saying allergies, I'm talking about specifically allergic rhinitis, which is the hay fever, the sneezy, stuffy, runny, nasal things. I'm not talking about asthma or peanut allergies. But step 1 is to find out what people are allergic to and try and get rid of their exposure the best we can. That's the safest and the most effective way. Unfortunately, a lot of people are so married to their cats and dogs, they refuse to give them up. So I always start by saying, I know no one gets rid of the cat or the dog, even though it's very effective.
And you could not be allergic and then bring them home and then you're allergic,
You can
right?
develop an allergy.
How do you do that then? So you're right.
And I've seen a lot of people not allergic to cats or dogs, absolutely miserable near cats or dogs because they're allergic to the dust mites that live in the animal dander. Fascinating studies they did years ago where they find that certain men, they have dust mites in their beard. And so the wives can develop allergies from the husbands having the beards.
Oh my gosh.
So I did have one patient who was fascinating. He had a long
Shave it,
beard,
baby.
long hair, long and full beard. He was all ready to start allergy shots. I bumped into him a year later. I said, what happened? He says, I shaved everything off. I was cured. I didn't need anything.
So what happens then if you do have an allergy, you're diagnosed with something, and you get these allergy shots? Are there side effects? What happens when one begins that type of a regimen?
All right, so let's talk about it first. Step 1 in treating allergies is environmental control, finding out what they're allergic to, try and get rid of it the best we can. There's no side effects. Second step in medicines, we've got a lot better medicines than we used to when I first started. If people are great, we're finished. If they're still not doing well, then we worry about allergy shots. So the allergy shots are for people who are not responding well, who aren't able to tolerate the medicines, and are still having problems, especially with an unavoidable exposure, like cats or dogs or so on. So the allergy
beards.
shots are actually what they're allergic to. It's very specific to that individual. It's not like giving a general prescription for penicillin or what have you, or aspirin. You know, the allergy shots are specific for what that person's allergic to. And you start with a very low dose and you gradually build up. Over time, the body's immune system learns to ignore it. So when you breathe it in real life, nothing happens.
Okay.
But it's not an overnight thing. I don't give you a shot and tomorrow you go out and cut the grass and feel good. But there are potential side effects to it. So they're definitely effective. The good thing about the allergy shots is that they work. Most people feel better, take a lot less medicine. Nothing in life is 100%. Most people feel better for many years after they stop. The bad thing about the allergy shots is they're allergic to it and I'm giving it to them.
Yeah.
So I only do it in people where I can treat them in case they have a bad problem. Most people are fine. Some people will have some itching or swelling where they get a shot. Very rarely they may get hives or shortness of breath. So we only do it in young, healthy people. We watch them 20 minutes afterwards, and in case there's a bad reaction, we treat them right away.
Okay. Explain what, because I think this may help too. What is histamine versus antihistamine? Obviously, it's the opposite, but what actually does it, and what does it cause? What happens in the body when that's going on?
So the way allergies work is you get exposed to something, your body says, I don't like it. You have allergy cells called mast cells. Think about them as like floating World War II mines, sitting there and doing nothing.
Okay.
But when you're exposed to something that bothers you, the trigger, then you have allergy antibodies called IgE on these mast cells. And they recognize and say, basically, warning, you're under attack. And these mast cells will now explode and release lots of chemicals, including histamine and other chemicals. So histamine will cause itching, swelling, increased blood flow to the area. And so that's why your allergic reaction depends on where you're exposed and how much histamine is released. So if you have histamine in the eye, you can have red, itchy, watery eyes. If you have histamine released in the nose, you're going to be stuffy, runny, sneezing. If it's in the lungs, you may get short of breath or wheezing or coughing. If it's through your whole body, you may get hives or swelling, or even the blood pressure may drop.
And is that then, do most people who have allergies then, depending on what they are, carry an EpiPen then? Is that?
No, that's unrelated.
Okay, so what does that have to do with it, just to clear that up?
Okay, so histamine is what causes a lot of allergic reactions. As we mentioned, there's a lot of other chemicals being released at the same time.
Okay.
Antihistamines, whether it's Benadryl and the list goes on and on and on, will block those, but is not going to treat the other parts of the allergy. So for people with mild reactions, they may take an antihistamine and feel fine. Those people usually don't bother seeing me because they don't need me.
Right.
But for more severe reactions, which can involve, as we mentioned, people can get heart attacks, they can collapse, the throat can swell, they can get short of breath, then you need to give stronger medicines. So other medicines you could use for a severe reaction may include steroids, but the strongest one, the most potent one, will be epinephrine or adrenaline. that will save lives. So in case of a potentially life-threatening reaction, then I say you really got to use it early, and if you have to repeat it, you repeat it. And that's where the EpiPen comes in. Do you want me to show you how one works?
I would love it. Do we have one here? Great.
We have a fake one.
Yay.
You know, sure, you're a very
Fake
nice lady,
hand?
but I don't share needles. I've lived
Okay,
around
that's
for 9
good.
years.
Thank you.
This is a fake one.
Okay.
You take off the cap. That's the part everybody forgets.
Okay.
The other end is the important end. Okay, this orange. Through the clothes, upper outer thigh. Now watch how gently I push it. And I just leave it there for 1 or 2 seconds.
Okay.
I always tell my patients, they say 10 seconds, they lie. It really
Okay.
comes out in the first 1 or 2 seconds. It is adrenaline. It'll make your heart race. It'll make you jittery and nervous, but it saves your life. And it's amazing how quickly it works. Within a minute or 2, people feel significantly better. A couple of other misconceptions. A lot of people say, oh, if you use the EpiPen, you have to run to the ER.
You don't.
I tell my patients they don't have to unless it's not working.
Okay.
I was just at a wedding a month ago. A friend of mine who's allergic to nuts, they had put some nuts in accidentally into the non-dairy creamer. It must have been almond milk. So he started getting flushing, and he took his steroids and prednisone. He wasn't getting better, and he was more itchy, and his throat was starting to close. So I said, take the EpiPen. And literally, as you're talking to him, within 30 seconds, his face cleared up. He felt more comfortable.
Wow.
And within 5 minutes, as though nothing ever happened.
What I find so fascinating about allergies, doctor, is that the severity of an allergic reaction, like you're saying, could cause death if
Sure.
if it's not taken care of. That is really scary. And I know now why parents of children with peanut allergies, they're petrified to let their children go somewhere, even with a pen sometimes, they think, because they're afraid that what's going to happen beyond my control, and even with your control.
Well, unfortunately, there really is a concern there.
Yeah.
I always tell my patients the problem is never at home. Let's say your kid's allergic to to peanuts. You never have peanuts at home. The problem is they go to a friend's
Outside.
house, the friend just had a peanut butter and jelly sandwich and takes a drink of their Coke. That could be serious enough to cause problems. There was a couple of years ago they discussed about somebody who kissed somebody else with the peanuts and had a life-threatening reaction. Or you go to the friend's house and their Aunt Sally's secret recipe has got peanuts in it. Thai chicken's got a lot of peanuts. When they go out to a restaurant, they can get in real trouble. But since you're mentioning the peanuts, which is really one of those more severe
I was just
reactions.
going to say, is that one of the worst ones?
That is
or
one of the
most
worst
severe?
ones. And that
Okay.
also can last, in 80 or 90% of people, that can last for life.
Wow.
So they don't outgrow that. A lot of the other ones, milk and eggs, over time, people can outgrow. But the fish, shellfish, nuts, and peanuts, they tend to stay forever. And some fascinating studies, they're finding out now that, when you do this long enough, you find everything we thought was absolutely true is now absolutely false.
Yeah.
So now they're finding that the latest theory, which is probably correct, is that the earlier you expose the kids to peanuts, the better off they are. You don't want to wait. And the thinking is that if they have a skin rash or they get exposed through the skin with the peanuts, then their body's going to say, oh, peanuts is a foreign substance, let me make an allergic reaction. If they eat it first, then the body says, oh, this is a food, I'm going to have something called oral tolerance, I'll get used to it, I won't make an allergic reaction. So feeding kids peanuts and so on, 3, 4, 5 months of age is much better than waiting till they're 2 or 3 years of age.
Yeah, it's amazing because that's, I think, the scariest part. So that is one of the worst. I mean, when it comes to medicine, that's scary too. I mean, both of my
Sure.
children have allergies to medicine. I have allergies to 2 types of medicine. It's scary when you think, and one of them I took 10 different times. The 11th time I took it through my life, I became severely allergic to it.
Well,
so that's weird.
That makes a lot of sense because in order to develop an allergy, your body has to be exposed to it. So in theory, the first time you eat shrimp, the first time that you take penicillin, you shouldn't be allergic. But if that's the way your body's DNA is, the 2nd time, the 10th time, the 50th time you're exposed, you may develop an allergy, which also explains why drug allergies are more common as we get older because we've been exposed to a lot more. If you think about a healthy 5-year-old, they don't take any medicines.
Right.
So they can't possibly have an allergic reaction. But as we get older, you get exposed to a lot more medicines and it's much more likely to develop a medicine allergy.
So is asthma an allergy?
Let me show you what's going on with asthma.
Okay.
Since
Go
I do
right
have
ahead.
these posters here conveniently enough.
Sure.
In everybody, when you breathe, the air goes through these airways, also called bronchi or bronchial tubes. The real problem in asthma is that these airways are too sensitive. They're hyperreactive to triggers. Different people have different triggers. Triggers may be cold air or exercise. Other people, triggers may be an irritant like cigarette smoke or perfume, strong smells. An allergy can be one of the triggers, not in everybody. And other triggers could be also acid reflux. And the most severe trigger often is a cold or sinus infection. So the point is, first of all, anytime it gets worse, the most important question has to be, what's my trigger, what's going on? Because if we don't deal with that, we're not going to get them better. When someone with asthma is exposed to trigger, there's two things that happen in the airways. First, you have all these muscles here that squeeze or tighten. That's called bronchospasm. At the same time, you get a lot of mucus and fluid around, what we call inflammation. So what happens is people end up breathing through a small straw. That's really what's happening in asthma. What they notice depends. Some people may wheeze, some people may cough, some people may get short of breath, or they may feel the chest is heavy or tight. It doesn't mean necessarily you get all those things. And people used to think, well, if it's not happening every day, it's not asthma. That's not true. There's two kinds of medicines we use to treat the asthma. One's a medicine called a bronchodilator, which I conveniently enough have a whole list here of these bronchodilators, medicines like albuterol. They work right away to make you feel better. So if you feel good, don't touch it. I don't care if you don't use it for a month or two. If you need it, you use it. This is important. If you need it again, even 20 minutes later, do it again. A lot of people make the mistake of saying, well, it says to wait 4 hours or 6 hours. That's when they get in real trouble.
Right.
If you need it, you use it because you have to breathe. If you need it again in 20 minutes, do it again. If you've done it 3 times in an hour and you're not better, yeah, then I would go to the emergency room. But you can avoid a lot of problems by repeating it.
Now, are you telling me that that tiny little up there is all the airway they have, the air?
Depending on the person.
Wow.
So when someone's needing this rarely, they're in good shape.
Yeah.
But when they need it more than once or twice a week, that's telling us there's a lot of inflammation. We got to do a better job. And that's where we reach for an anti-inflammatory.
Okay.
Which doesn't work right away. Think about it like if you have a rash and you put cortisone on, it's going to work, but it's not going to work immediately. So over hours, over days, over weeks, they're going to get better and better. And that's this whole class of inhaled anti-inflammatories. So those kinds of medicines, if people need it, they take regularly over time. And that way they'll feel better. But they still always keep their bronchodilator as a rescue inhaler anytime they need.
So an allergy can actually contribute or cause issues with asthma then, is that correct?
Right, but it's not the only trigger.
Okay.
And people with allergies have a higher risk of asthma as well.
Wow. Now, can asthma be diagnosed later in life too? What's usually the diagnosis on asthma?
It could be any age.
Okay.
It could be any age.
Okay. So if someone came to you or someone's suffering with cold symptoms and they feel, I don't know, is this allergy? Is it a cold? How do you best tell the difference between whether it's allergy or cold? A cold.
Well, sometimes it's easy. Everybody in the family's sick and they've been sneezing and snuffling for a few days. That's a cold. Sometimes it's easy. Every May, every June, they get the same nasal symptoms. Well, that's an allergy, and we can do the allergy testing and find out. But sometimes it's not so clear. The other thing I want to discuss with you is some people don't have a cold or an allergy, they have a sinus infection. So I want to show you that if you want to come over here.
That I know. Yeah, sure will.
I have that right here. These are the sinuses. These are big holes in your skull with small little openings. The problem is when these openings get blocked, that's when you get in trouble, because instead of everything draining the way it's supposed to, it stays behind and gets infected. It can be blocked from allergies, it can be blocked from a cold, or a lot of other reasons. I don't expect a fever. What people might notice, some people have pressure or pain here. They may get stuffy nose or runny nose, which may be colored. Teeth pain or decreased sense of smell. Some people get more of a drip, sore throat, hoarseness, cough, bad breath, bad taste, blocked ears, dizziness, circles under the eyes, or exhaustion. That's a sinus infection.
Wow. This really affects everything, doesn't it?
It does,
the sinus
sure.
area? When you think your teeth, I know, because I
sure.
suffer from sinuses, and it's, thank God, yeah, there you go. I know that the top of my eyes, my teeth can hurt. Or when I went to the dentist the last time I went, she said, "You having some sinus issues?" And I said, "How do you know?" She said, "I can see the postnasal drip." I'm like, "You can?" Like, you don't think that that's what happens when all these things are so mingled here. She actually knew that, and I said, yeah.
I see all the time, people go to the dentist for teeth pain, and they get an
Sinus.
X-ray, and they say, no, the teeth are fine, you have a sinus infection.
Yeah.
I see that all the
Why
time.
though? Why does that affect the teeth?
There is this much space right here between the top of the teeth and the
And the
sinus.
sinus cavity. Okay.
And sometimes it works the other way. I had one patient, I remember she was saying, as she was having her teeth pulled, she felt her sinuses cleared up and she was cured. But they're really very closely related.
Woof, yeah. So I know, because trust me, I know all about it. But I deal with it. It's one of those things, you live with it, and this time of the year it's crazy.
Sure.
But you just have to do what you have to do.
So there's different kind of allergies. One kind of allergy, what we call perennial, year-round. People allergic to cat or dog, people allergic to dust and mold. The other kind is more the seasonal one, and there's different times a year for that. So the tree season is usually more March, April, May. Grass season is May and June. So usually May is the worst because you have tree and grass all together and everybody's miserable. Then you get maybe somewhat of a break in July, and then come August you get ragweed, which is August 15th till the first frost.
Yeah, and that's the sneeze. That's the word. My mother has that. And I remember as a kid, used to think, and she used to say, it's hay fever. And I'd say, what? What is that? Because the sneeze, you could feel it came from her toes out. That's how severe. So that, and she's 78 years old and still dealing with it.
Must be good for her immune system.
Well, I guess. Let's see. Let's hope it's something, because it really, now do you feel, because I think this is important, for me, I just take an anti-inflammatory and I roll with it. What about people who really get can it be debilitating?
Oh, absolutely.
Yeah.
Absolutely. I have some people that are just exhausted, they can't do anything. Especially with the sinus infection, they tell me sometimes they feel like they have mono. They're just wiped out and they can't do anything.
Wow.
So it can be very severe.
So the best way for them then, if someone wants to say, I think I should talk to an allergist, what's the best? Do you have to go through your doctor? Do you just make a regular appointment? How does that happen when someone wants to see? Because are you considered a specialist then, doctor?
Absolutely.
Okay, so then if they want, they can just call and you would go through a whole, just like anything else, with trying to find out what the problem is.
Right. You want to make sure that when you see an allergist, you say, are you board certified in allergy?
Which you are.
Which I am.
Right.
Or else I wouldn't be telling you this.
I know that. Well, you could. Just that could be the opposite. But no, I'm kidding. Go ahead.
But generally, you want to make sure someone's board certified
Yes.
or board eligible in that specialty, because sometimes in medicine there's a lot of overlap between different fields. For
Yes.
example, I deal with asthma, and a pulmonary doctor deals with asthma, and there's going to be some overlap in the
Okay.
asthma. I'm not going to treat lung cancers. I'm not going to treat somebody in the ICU, but I will treat the asthma with them.
Okay.
So similarly with skin doctors, with dermatologists, we have a lot of rashes that we both see together, poison ivy, contact allergy, hives, and so on. If it comes to the skin cancer or some of the other stuff, psoriasis, I will not deal with that. That's not my specialty, but when it comes to the allergy rashes, I will.
Now, can those skin issues like psoriasis or eczema be an allergy-related issue, or no?
Not psoriasis, but a lot of the eczemas can,
Eczemas?
but it's called atopic dermatitis. It's
Okay.
very, very common. It's become more common. Let me talk about that for 1 second.
Sure.
So atopic dermatitis, there's a lot of different kinds of eczema. Eczema comes from a Greek word meaning boiling over. So poison ivy is an eczema.
Okay.
Psoriasis, though it's not allergic, is an eczema. But atopic dermatitis is specifically what we see a lot of times here. It's usually a personal or family history of allergies. It's very itchy. And the classic story is they say it's the itch that rashes. They enjoy itching much more. They have a much lower threshold for itching. So they start scratching, and classically it's going to be elbows and the knees. And because they scratch, that causes the damage to the skin, and they break out with the eczema, usually as they get older, with the elbows, in the flexor surfaces of the elbows and the knees. And then you want to find out what's triggering them, what's making things worse. And sometimes it's interesting, these kids, usually kids, because it's much more common with children, a lot of people outgrow it, but I've seen a lot in adults. Usually what happens is that they can't fight off germs as well, so they're more likely to have staph in the skin. When they're scratching, they can get a staph skin infection, which makes everything worse. So sometimes when people are out of control, I've got to give them antibiotics for a short time to get things under control. Another thing we've been doing recently, and I didn't come up with this, I just pay attention to the brilliant people, to decrease the amount of staph in the skin, we use sometimes bleach baths, where people put a very small amount of bleach in the bathtub and the kid soaks in it. They have less staph in the skin, and they get a lot less infections, and they feel much better.
Wow. Well, that's neat. But I know, so that's where then the crossover, as you were saying, that made me think of it when you
Sure.
said dermatologist. That would be the crossover because the skin is affected and it's a different
Sure.
type of medicine than what you're doing, but they're related.
Absolutely.
Good way. Anything else you'd like to say before we wrap up? This was great, by the way.
Oh, that's a pleasure
Very
having you here.
informative. We're happy to be here. Anything else that we missed that you might want to say before
I think you
we...
covered it all. I'm very impressed.
There we go. Thank you very much. And by the way, love the ice cream, love the candies behind us. This is all working today. So Joel, thank you very much. You don't mind that I called you that, do you?
Not in the least.
All right, here we go. So this is our first edition of our 2016-17 edition of our Lackawanna Medical Society's Public Health Series. So look for us next month, and we appreciate you listening. Dr. Laurie, thank you very much. And we'll see you real soon. Thanks again. I'm Laurie Cadden. Have a great week.